My name is Andrew Karasick, and I'll be sharing our work with you today on behalf of myself and my co-investigators, Judith Graber, Iris Udison, and Michael Guzmano. Next slide, please. Here are some disclaimers before I start. Next slide, please. So substantial improvements in healthcare access have been made in recent years, largely associated with expanded government programs. Nonetheless, a substantial number still don't have basic access. To further understand how federal programs might be associated with access to care, we studied the General Responder Cohort, an open cohort of workers and volunteers who were part of the rescue and recovery effort after the 9/11 attacks on the World Trade Center in New York City. Cohort members are eligible for free annual routine monitoring visits and are also eligible for no-cost monitoring, treatment, and referral services for diagnosed conditions certified as related to World Trade Center exposures, provided by the NIOSH-administered World Trade Center Health Program via Clinical Centers of Excellence, or CCEs, listed here. CCE providers function like primary care providers for evaluation and management of certified World Trade Center related conditions. As part of this program, data are collected from consenting participants to better understand exposures, health, and other attributes. Next slide, please. We aim to learn more about utilization of the CCEs, as well as healthcare access of the cohort beyond monitoring and treatment received through the World Trade Center Health Program. To better understand overall healthcare access and potential drivers of CCE utilization, we identified an instrument that captures such information. And to better understand healthcare access in the cohort, we aim to compare it to that of another population similarly exposed to the 9/11 World Trade Center response. This comparison population was selected from the New York City Community Health Survey, an annual survey conducted by the New York City Department of Health and Mental Hygiene, designed to understand health and risk behaviors of adults living in New York City. Next slide, please. Now I'll tell you more about the data sources for our study. So the Benefits Eligibility Assessment Screening Tool, also known as the BEAST, was launched by the World Trade Center Health Program in late 2017. The survey aims to create a customized benefits counseling plan for each member and gathers information to inform the program and enrollees on additional assistance members may be eligible to receive. Each survey is linked to the CCE visit number of the respective respondent at the time of survey administration. The World Trade Center General Responder Data Center provided us with de-identified BEAST survey data from October 2017 to May of 2019. The Rutgers CCE was selected for this study because it administered the BEAST nearly continuously since the survey began. And we focused on characteristics attributable to healthcare access, including having medical insurance, a primary care provider, and proportion with delayed medical care. The World Trade Center Health Program surveys are administered before or during annual monitoring visits to CCEs. At enrollment, surveys ascertain demographic information, medical history and diagnoses since the 9/11 response, health behaviors, and World Trade Center related exposures. Members are reassessed for health behaviors and medical history at follow-up visits. And the New York City Community Health Survey is a cross-sectional telephone survey with an annual sample of around 10,000 randomly selected adults living in New York City. It includes healthcare access questions identical or analogous to those of the BEAST, as well as questions about demographic and clinical characteristics, comparable to data collected by the World Trade Center Health Program. Next slide, please. We assessed the relationship between healthcare access variables along with other potential drivers of utilization measured by the BEAST and CCE utilization. The primary outcome was CCE visit intensity, defined as the member's cumulative count of visits at any CCE, including monitoring and treatment visits, and interpreted as an indicator of CCE utilization. The distribution of CCE visit intensity among BEAST respondents was right skewed, so we used a negative binomial multivariate model to assess CCE visit intensity for BEAST questions asked of Rutgers CCE attendees. Next slide, please. The data center generated descriptive statistics for demographic and health variables stratified by the Rutgers CCE and non-Rutgers CCEs, comparing Rutgers CCE members to the larger pool of CCE members. We assessed differences of demographic and health status variables between the Rutgers CCE and non-Rutgers CCE members using z-testing. Next slide, please. And we assessed differences between the Rutgers CCE members responding to the BEAST from October 2017 to June 2019 and World Trade Center exposed individuals captured by the Community Health Survey in 2017 in having insurance, having a primary care provider, having foregone needed medical attention in the past 12 months, and basic needs insecurity using z-testing. Next slide, please. And we assessed differences in demographic and health variables between CCE members as of June 4th, 2019, and World Trade Center exposed populations captured by the Community Health Survey in 2017 using z-testing. Next slide, please. So here we can see in our descriptive statistics derived from BEAST data that around 10.8% of respondents reported lacking at least one aspect of healthcare access. And you can click. And next slide, please. So here the model suggests that having one or more certified physical health conditions was positively associated with having had more than twice the number of CCE visits compared to members without a certification. Problems accessing medical care not covered by the World Trade Center Health Program and trouble paying for basic needs were positively associated with more CCE visits. And you can click. And you can click again. Okay. Next slide, please. So in this table, we see that when compared with non-Rutgers CCE members, a higher proportion of Rutgers CCE members were male, Caucasian, higher earning, and partnered. Rutgers CCE members were more likely to be diagnosed with GERD, sleep apnea, and cancer. Next slide, please. And here we can see the Rutgers CCE members who completed the BEAST differed substantially from the 9/11 responder subgroup of the Community Health Survey in terms of healthcare access and basic needs security. Rutgers CCE members and Community Health Survey respondents had similar rates of having health insurance and having a PCP. Rutgers CCE members were substantially more likely to have obtained needed medical care within the past 12 months and to have had food security. Okay, and members of the CCE and of the Rutgers CCE and the 9/11 responder subgroup of the Community Health Survey were similar in terms of age at 9/11 and diagnosed depression and diabetes. However, a higher proportion of Rutgers CCE members were male, Caucasian, higher earning, partnered, working, and hadn't attended college. More Rutgers CCE members had high blood pressure and had lower perceived levels of health. Next slide, please. High rates of overall healthcare access across the Rutgers CCE population is encouraging for the positive roles that the Rutgers CCE and the World Trade Center Health Program in general play in these patients' lives. As would be expected, having a certified related condition for which a CCE will provide cost-free surveillance and treatment was strongly associated with CCE utilization at the Rutgers CCE. Inadequate access to healthcare for non-certified medical conditions and basic needs insecurity were positively associated with CCE utilization at the Rutgers CCE. As such, CCE might be serving as somewhat of a safety net for surveillance and treatment of a certified condition that might otherwise be managed by a patient's own private medical providers. And differences in healthcare access between BEAST respondents of the Rutgers CCE and the 9/11 responders of the Community Health Survey identified healthcare disparities between these two groups. However, this isn't surprising since these groups differed in terms of demographic characteristics typically associated with healthcare access, such as income, ethnicity, and marital status. It's concerning that nearly 1 in 7 9/11 responders surveyed by the Community Health Survey had missed out on necessary medical care within the prior year. Further outreach to 9/11 responders in the New York City area may be warranted to ensure that all have been offered at least one screening exam from the World Trade Center Health Program. Screening tools like the BEAST offer an ongoing opportunity for medical surveillance programs such as the World Trade Center Health Program to better identify healthcare access gaps and resources available to overcome such gaps. Ultimately, such efforts serve to better understand and address healthcare access disparities. Next slide, please. As for limitations, Rutgers CCE members were more likely to be men, Caucasian, wealthier, partnered, and sicker than non-Rutgers CCE members. These differences may drive different utilization patterns for the non-Rutgers CCEs. Further study of BEAST data from all CCE sites would confirm whether the observed relationships extend beyond the Rutgers CCE. Comparison of the 2017 Community Health Survey data with BEAST data that span multiple years could be a concern if changes in healthcare and access had occurred during that time interval. However, there were very few differences in questions across the surveys, and these were limited to a small minority of the questions. And furthermore, it's certainly possible that some of the 9/11 responder subgroup of the Community Health Survey also enrolled in the program and are members of at least of one of the CCEs. However, such overlap would be expected to reduce differences between the two samples and diminish any statistical significance of any of the many differences found between them. Next slide, please. So here are some of the takeaway points, as you can see there. Unfortunately, we don't have time today to discuss a qualitative component of our study, which examines perspectives on the BEAST survey itself. Teresa, if you could move the slide deck to the end. I'd like to acknowledge the important partners who helped make this work possible. Otherwise, I'd be glad to answer any questions any of you have about the study.
Hey, John Meyer, did you have data on unionization in these members there? Because those are oftentimes an important source, whether they're working or oftentimes even in retirement, because my understanding is that the BEAST or some of the other questionnaires offer that. So that might be a differentiating point. Did you use that data or find that?
Yes. I sped through the charts a bit because of the time restraints, but the BEAST did include the unionization data, and we did include that in our analysis.
Any results on that? On their inclusion, or are you still working through?
So I believe there wasn't anything that was statistically significant, I don't believe there was some effect of having been an employee of New York City that I didn't include, that I didn't share. But other than that, the unionization data did not really have too much of an effect on them in the model.
Could I ask how the, I'm sorry, I missed the very beginning of your talk. How does the Health Community Survey identify a World Trade Center responder?
So interesting, good question. So typically the Community Health Survey, which is administered every year, would not ask about World Trade Center responder status. But in 2017, they added almost a one-off question for that year's survey where respondents could identify that they had spent time on site at the World Trade Center doing some type of relief or rescue work. So that was an opportunity to get a subsample of this survey in 2017 to examine them and compare them to the World Trade Center health program population.
Well, thanks very much. Just send me the names and I'll sign them up.